Thanks for listening to the Lunch and Learn with Dr. Barry, here to help educate, motivate, and put you on the right path to take control of your health through weekly discussions on topics in the medical field, public health arena, and in your community. And now your host, Dr. Barry.
And welcome to another episode of the Lunch and Learn with Dr. Barry. I'm your host, Dr. Barry Pierre, your favorite board-certified internist, host of the Lunch and Learn with Dr. Barry, your number one podcast for patient advocacy, helping you empower yourself for better health. This week, episode 95 is going to be a good one. We are talking about pneumonia. And unfortunately, it's one of those topics that I thought was already a big deal, but with recent events, depending on when you listen to this, it really brought to light that a lot of people don't really know how severe pneumonia is, right? And it's crazy because I'm talking about one of the top 10 causes of death worldwide, which is pneumonia, right? But for some reason, it was not met with the reputation that I thought it would be met with. So I figured let's talk about pneumonia. Let's bring this great topic out to light, especially for the Lunch and Learn community. Let's give it the reputation that it deserves. So if you want today's show notes, head over to lunchlearnpod.com or drbarrypierre.com for today's podcast show notes. And if you have not had a chance, go ahead and subscribe to the show. Share this episode with someone who you know is either affected by pneumonia one way or the other, whether they've had it or they have a family member who's had it. So like always, let's get ready for another amazing episode here with the Lunch and Learn with Dr. Barry. This episode is brought to you by the Lunch and Learn community store, where we are living out the motto, empower yourself for better health. In the Lunch and Learn community store, you can get your favorite t-shirts, ebooks, as well as other related products by Dr. Barry. Head over to shop.drpiersblog.com and get a chance to get 10% off your first purchase by using the coupon code Empower10. Again, shop.drpiersblog.com. Live out the motto, empower yourself for better health. So we are going to be talking about pneumonia today, and unfortunately, the topic really came to mind because of all of the reaction that came from recent news in the media of Kim Porter's cause of death. Kim Porter, you may not know, is a former model, actress, and she's also the ex-wife of Sean Diddy Combs. So she unfortunately suddenly died in late November. It was a big mystery. No one knows why, because I think she was like 47, 48. No one knows why she dies. And we finally got the report, coroner's report, almost like 3 months later, right? And essentially says she died for causes of lobar pneumonia. I got a few things to kind of talk about that. As a physician who unfortunately has to write a lot of death certificates, and I say a lot because if you have to write more than one, that's a lot. So I do have to write quite a few death certificates. And a lot of times, especially when we're talking about patients who are sick, there are so many different factors and things that attribute to a person, unfortunately, not making it and not leaving the hospital. But in the grand scheme of things, there's really certain few categories that I have to put down, right? So again, I can't say a person passed away because they had a heart attack, right? No, I have to say a person passed away because they had coronary artery disease, right? So I can't say a person passed away because they stopped breathing. No, I have to say a person passed away because they had pneumonia or infection or something. I have to be extremely specific when talking about causes of diseases, right? So when you hear, the cause of death, lobar pneumonia, yes, that's a central thing, right? But again, that's not to say that's the only thing that happened, right? Like she got pneumonia, she died, but they're saying that when you surround and you gather everything that happened with her, you have to attribute a lot of it to the fact that she had pneumonia. And I think what was interesting to me, because I was sitting back and being on social media, was the reaction from the cause of death. One, because I think a lot of people were expecting some type of foul play, or they were probably expecting some type of drug-related issue. So, when they hear pneumonia, it's not a sexy term. So, there's that. But two, the almost lack of respect for pneumonia as a cause of death was staggering to me. And we're going to talk today about pneumonia and why everyone should be focused on pneumonia and focus on the importance of it kind of moving forward. So I'm going to be talking today. We're going to be talking about pneumonia. I'm going to give you some facts on pneumonia. We're going to say what is it, who's at risk, how to get treated for it. What are some symptoms if you have, like, how do you know if you have pneumonia? We'll talk a little bit about treatment. Here on the Lunch Note, we don't get into specifics about treatment just because a lot of times there's so many different options. But we'll talk about the broad scheme of treatment courses kind of associated with pneumonia. So let's do this, right? So just so I can get you guys in a mindset of why pneumonia is important, right? Pneumonia is something we need to worry about. As a hospital physician like myself, pneumonia causes about 500,000 hospital visits every year. And 500,000 hospital visits every year may seem like a lot, but when you think about the fact that a lot of people get treated for the pneumonia before they come to the hospital, so they don't even make it to the hospital, which means that a lot of people are experiencing pneumonia, right? Like when I say a lot, how many? About every year, 400 million people are affected by pneumonia in one way, shape, or form on a year-to-year basis, right? 400 million people, right? I think the number is actually closer to 450. About 50,000 people here in the United States die from pneumonia every year. 50,000 people. So we talked about the 500 who end up in a hospital. Almost 10% of them don't make it out of the hospital. And pneumonia, again, as a public health professional, I'm very well aware of like how much pneumonia affects on the worldwide scheme of things, right? Like I understand, one, it's the second most common reason for a patient to end up in a hospital. It was in 2016, it was the fourth leading cause of death worldwide, pneumonia, right? So, I know, hearing lobar pneumonia isn't as sexy as hearing drug overdose, right? But I want you guys to really be paying attention to why we should be focused on pneumonia, right? It's not something that we could just say, oh, you got pneumonia and, kind of go and brush it off and vice versa, right? Like I had a lot of patients when I used to do outpatient medicine. But it always comes, oh, doc, I got pneumonia. I feel it, right? And it's a lot of times because they don't necessarily understand the severity of what you having pneumonia does versus you having kind of like the regular cold, which a lot of people more tend to have. So just to kind of get us into definition terms, right? So what is pneumonia, right? Pneumonia is an affection that affects one or both lungs. A lot of times in the hospital setting, we get patients who will have one side of the lung affected. Sometimes we have patients who have both sides of the lungs affected, right? And it's just one of those things that you always have to be mindful of when patients come with certain symptoms, right? And we'll talk about the symptoms in a little bit. So it affects the lungs, right? So that's our grant. That's where we're working at, right? That's our real estate. Pneumonia affects the lungs. It affects a lot of other things downwind, but in the beginning, in the primary stage, it affects the lung. It is caused by bacteria. It is caused by viruses. Is it caused by funguses, right? So there's a lot of different ways you can get pneumonia, right? It's not a one size fit all, right? There's a lot of different ways you can get pneumonia. And unfortunately, a lot of times when we're talking about like being contagious, right? Sometimes you can be contagious for pneumonia, right? You can be spreading your sickness before you even notice it. And by noticing it, we're talking about coughing, sneeze. We're going to be talking about some of those symptoms. But those are some of the things that you may experience. So you may not even experience a symptom before actually having the problem, right? Because again, a lot of people are like, well, she had pneumonia. How come she didn't go to the hospital quicker, right? And per the story, she actually saw a doctor and wasn't being treated adequately on an outpatient basis, and she ended up in a hospital, right? Again, that's actually not an unordinary situation. A lot of times, especially for patients who have doctors, a lot of times they go to their doctor's office, their doctor prescribes them some medication, And if it doesn't work, they end up in the hospital, right? It's actually not the norm to go straight to the hospital, right? Which I think a lot of people were kind of insinuating. Well, why didn't she just go to the hospital in the first place? Well, that's because a lot of times your primary care doctor is able to take care of it and prevent you from going to the hospital. And on the other hand, a lot of people don't like going to the hospital. So they'll avoid it like the plague, just like sometimes they avoid physicians like the plague. So we talked about it being caused by bacteria. We talked about it being caused by viruses. We talked about it being caused by some funguses as well. Those are your really, really sick patients, right? Especially with funguses affecting it. About 1/3 of pneumonia cases are due to viruses, right? So that means 66% are due to the other guys, right? And that's where the antibiotics and everything kind of comes into play, especially when we're talking about treatment course. But like I know you're listening, learning community. You're probably saying like, well, like why do I have to worry about pneumonia, right? Like who is a person that I need to be concerned about? Like if they have this, right, they have to be at increased risk for pneumonia. So, and this, if for those who followed my episode on the flu, I will put it in the show notes. This kind of mirrors the flu, and we'll talk about the relationship with the flu and just regular, especially bacterial pneumonia. People who are over the age of 65 have an increased risk for getting pneumonia. People who are under the age of 2, right? These are kids. People who are under the age of 2 also have an increased risk for getting pneumonia. So, but we're also going to talk about, let's say if you fall in between that, right? Like, is there any other medical issues that you can have that can preclude you to being at a higher risk for pneumonia? And the answer is yes. Yes, it is. You can have diabetes. You can have asthma. You can have autoimmune disorders like rheumatoid arthritis and lupus. Like you can have chronic kidney disease. So you can have quite a few disorders that put you at just an increased risk for getting pneumonia and getting very sick from pneumonia than a person who is over the age of 65 or under the age of 2, right? So again, so we use those ages as kind of hard markers, but most importantly, we need to understand that you can be 30 and get pneumonia. You can be 40 and get pneumonia. You can be 50 and get pneumonia. You can be 15 and get pneumonia. So again, it doesn't discriminate the age. It just looks for the best environment. And a lot of times the people who are younger and the people who are older are usually the best environment for a bug like that to grow. But that doesn't mean that it can't catch you in between time. And of course, my smokers, right? Like if you're a cigarette smoker in 2019, guess what? You're at an increased risk for pneumonia. You're at an increased risk for a lot of different things, and we've talked about that probably ad nauseum here on the podcast, and we'll continue talking about that. But you're definitely at risk for a pneumonia if you're a cigarette smoker, right? So again, if you need another reason not to smoke cigarettes, hey, maybe I want to avoid pneumonia, and that's why I'm going to quit cigarettes today. Whatever reason, again, we're episode 90. We're 95 episodes in. I've been talking about stop smoking cigarettes for a while. I'm going to keep talking about it till we're in 200 episodes in because I just want to stress the importance of it, quitting. So let's talk about the symptoms. Dr. Barry, you're saying, hey, like, how do I know if I have pneumonia, right? What are some of the symptoms that are usually associated with people who have pneumonia? Well, good question. So number one, right? People who tend to have pneumonia will tend to have a very heavy productive cough, right? And when we say productive cough, these are people who will cough up green and brown and yellow. They usually cough up a different type of different color sputum. And that leads you to believe like, hey, you may have an infection brewing on in the inside that's just regular, that's more than your regular cold. If you're elderly or even if you're a kid, you can get very confused, and this is what we call altered mental status, right? So you can become very confused, very altered if your pneumonia is pretty significant. Of course, you're going to get fevers, you're going to get your sweating, your loss of appetite, loss of energy, body chills, body aches, shortness of breath, all of these things. And again, if remember, when we talk about the definition of pneumonia, it's a disease that affects the lung. So you got to figure anything that can affect the lung, whether it be breathing, whether it be laying down, all those things are going to cause problems. So, and these are a constellation of symptoms that occur, especially when we're dealing with the bacterial pneumonia, but viral pneumonia causes similar things too. Viral pneumonia will actually give you some more body aches and pain. Those who may be aware of the symptoms of the flu, like we talked about, again, I'm going to put the link to the episode on the show notes. You understand that the flu can also cause some body aches, some pain, and again, for a correlation, right? So we can kind of put it together. When we talked about risk factors for getting pneumonia, this is one that's probably more important. People who suffer from the flu are at an increased risk for getting pneumonia. So if you're dealing with the flu as we speak, right now, pneumonia is probably sitting there like, hey, this is my time to attack. So it's not uncommon. And again, I'll tell you a little story. I had a patient in residency who, it was a young girl, and a couple weeks prior, she was complaining of some body aches and pains, some chills, some fevers. Told her mom, they gave her loving care, they gave her Tylenol when she needed, so she kind of got out of that. But then, unfortunately, a couple of weeks after the initial symptoms gone by, she starts getting very weak, very tired, acting confused, just not acting herself. And they ended up bringing her to the hospital. And when she was diagnosed with pneumonia. And again, this was like a 15 to 16-year-old. So we're trying to figure out all of the things that could have happened now that she had pneumonia. And come to find out, not only did she get the influenza, which is the flu, but she got strep pneumococcus, which is a bacterial bug of pneumonia. And in doing so, it almost acted like a super infection. So it started out as the flu and flu-like symptoms, ended up being a super infection that ended up having the patient I was talking about have to stay in the hospital for almost 15 days. So this is a young girl who, and just like that, you're in my hospital for 2 weeks, right? So I'll never forget that type of case, and I'll never forget the importance of the flu and how not taking care of the flu can put you at risk for something like this. So in the hospital setting, in the outpatient setting, right? Like, doc, I hear you. I'm coming to my doctor's office. I'm telling them all my symptoms. What does my doctor do next? Well, I think first and foremost, your doctor is going to want to take a look, right? They're going to want to take a look to see, like, hey, are you dealing with pneumonia, or maybe you're dealing with something else, right? So that's one of the first things they're going to do. They're going to maybe do like a chest x-ray or a CAT scan of the chest, right? Or CT scan of the chest, right? They're going to be looking in the areas that they expect to be most affected. So if the lung is where pneumonia lives, of course, they're going to do imaging that goes after the lung. So you have some blood tests that also can tell you whether you have certain types of pneumonia. So these are just regular blood tests that a lot of times we run in the hospital because of it. And even the sputum, right? I talked earlier about how people will cough up brown and green and yellow, but a lot of times they just spit it out. In a hospital setting, and even in your doctor's office, he may tell you, hey, I want you, when you have this productive cough, just spit in a cup, spit in this specimen, let me know so I can send it off for the labs. And it's very interesting when you get these results from the labs, because you can have one instance where nothing is growing one day, and then the next 3 days you have a lot of things growing. So, and it's important a lot of times, especially when we're getting these sputum cultures, because we're not just getting it to be able to say, hey, you got this type of bug, but we're also, and most importantly, getting it to treat you. So when you get the treatment done, and you said, when you get the sputum culture done, and it's like, okay, this is the bug I'm dealing with, then you know which antibiotic is going to work. Lots of different ways to kind of diagnose pneumonia. But most important, especially for you guys, is how do I treat it? Like, how do I treat pneumonia? And on the outpatient setting versus inpatient setting, it is very different. And I think because in the inpatient setting, the hospital setting, You get access to IV medications that you just don't get access to here in the outpatient world. So in an outpatient center, right, when I used to do outpatient medicine, I used to love using amoxicillin, which is a penicillin type medication, especially for those who are allergic to penicillin. You may not be aware of that medication, right? I sometimes will use a medication called Levaquin, which is pretty good, especially on the lungs. I use medication called doxycycline. Again, it's another medication that's also good for the lungs, right? So there's lots of different antibiotic regimens, either on outpatient or inpatient setting. Rest is going to be extremely important, especially if you're dealing with a viral type infection that there's really no antiviral medications for cold. A lot of it is just supportive care and making sure they're doing all right and make sure they don't turn for the worst. So I think from that standpoint, kind of getting all your ducks in line, and whether you're doing antibiotics, where you're doing rest, that's really comes down to making sure you're getting the cultures and you're getting the blood tests and all of these things you need to set out to do when you are thinking about treating pneumonia. Now, what are the big things associated with pneumonia, right? Like, what really can happen if you get pneumonia? And I really want to stress this part out because I talked earlier about how on the coroner's report, a lot of things may have happened while you had pneumonia, but it's not going to make the coroner's report, right? It's not going to make the death certificate. When we talk about in the hospital setting, hey, what are some of the worst things that can happen if you get pneumonia? Number one is you can have infection that used to be in the lungs, but now it's in the blood, which is really, really, really not good. You can have what we call respiratory failure. So this is when you are too weak to breathe on your own and we will do it for you. Those, from an imagery standpoint, think about those people who are have a tube down their throat in ER, right? Those people cannot breathe on their own, so we are going to help breathe for you, right? So that's what we do in the hospital setting, right? Where we have to be very concerned that you may not be able to breathe on your own. And if you aren't, then we have to intubate. All right, so that's one. Number two, we talked about number one, that was number two, because number one, we talked about the infection in the blood. Number three, there's a disorder called respiratory distress syndrome. And it's a constellation of symptoms associated with people who have pneumonia. Right? So it's a constellation of different things that could happen if you have pneumonia. And from that standpoint there, of course, last but not least, death, right? Like if pneumonia gets severe and goes untreated, you will die. Why do we know you'll die? Because we know it's the fourth highest cause of death worldwide. So we know this isn't a benign entity that we have to think about. And I know what you're going to say, Doc, every time I get pneumonia, I just take care of my antibiotics I take and I do it at home. That is perfectly fine. In fact, that's ideal, what we would want it. But I understand that sometimes some people need to end up in the hospital. Right? Maybe they can't follow with their PCP, right? Maybe they can't drive to see them. So they need to make sure that they're well taken care of, and they may just end up in the hospital and you find they have pneumonia, but they do very well with the antibiotics that you prescribe. So the number one question is, how do I prevent it, right? Like, is there a possible way for me to prevent it? And I want you guys to kind of think about the people who are at risk. People who are at risk are kids under the age of 2. People who are at risk are people who are over the age of 65. People who are at risk are diabetic patients, asthma patients, rheumatoid arthritis, lupus patients. So there's a lot of different moving parts associated with the prevention. But most importantly, the two which may cause some controversy amongst some of us, is vaccinations. There are not only one, but 2 different vaccines for pneumonia. And if you're meeting this criteria, right, like if you're diabetic or you have asthma or, you're on chronic oxygen, right, and you have pneumonia, they recommend, hey, you should get the pneumonia shot. And there's 2 of them, and one is Prevnar 13, and the other is pneumococcal 23. And I already know someone's going to ask me, hey, what do those numbers mean? So I talked about the different causes of pneumonia. Well, guess what? We know the top 36 causes, right? We know the top 36 causes. So what do? We make a vaccine for those causes, right? We say, hey, we're not going to be able to get all the different causes for pneumonia under this umbrella, but if we give you these two vaccines, we should be able to cover the majority of them. And hopefully, after this take of the Lunch and Learn, you'll understand why you also should be very diligent about getting your pneumonia vaccine when it's time to get it. So, all right, guys, I thank you for all your support that you continue to show. Yours truly. I'm going to be seeing you next week for another amazing episode here on the Lunch and Learn with Dr. Barry.